because there's 3 phases of degeneration. So we know phase 1, as soon as you get in an accident, the curve is going to go straight. That's when people start having headaches, anxiety, problems sleeping. It can interfere with your breathing. You can have tightness in the chest. You can start having heart conditions, numbness and tingling in the hands and fingers. All of that from just a whiplash in the neck. And if it is uncorrected, then it will start creating health problems. So.
Welcome everybody back to the Healthy Habit Podcast. Dr. Roxane Zamora is back with us today, our doctor of chiropractic medicine here on the Healthy Habit Podcast. She's been in practice in North Phoenix, just up the road from us here, at the same location for 14 years. Dr. Zamora provides chiropractic corrective care and car accident care for all ages. Welcome back to the podcast, Doc. How are we doing?
Thank you. I always love chatting with you because
Likewise.
we get so much great information from you as well.
Absolutely, folks. And if you missed our first episode with Dr. Zamora, make sure you head over to our YouTube channel or our Spotify channel to stay in the loop. This is our part 2 discussion. So, Dr. Zamora, what's one thing I wanted to know is, car accidents, chiropractic care is very important here. And a lot of people, they just go to the hospital after their accident, the ER visit, go home after on pain meds, and that's it. They're done. Why is it a good idea to consider potentially seeing a chiropractor after that, after you're all patched back up, and then like the days and weeks and months afterwards?
Yeah, absolutely. Because what will happen is people, if they go to the ER or urgent care, they'll say, "Oh, you're okay," and because what they're looking for are fractures, right? And so what they're saying is there's no fractures or internal bleeding or any concerns like that. But structurally, your spine is injured, right? Your structure, I've never seen a car accident patient that didn't have a straight curve in their neck. Because if we remember, when we look at the spine from the side, you need a curve in your spine. That goes straight because the muscles, there's sprain, strain, ligament tears, muscle tears, all of that can happen. And then it develops into chronic long-term concerns. Headaches is one. You can get a whiplash at 3 to 7 miles per hour. So people think, oh, I just had a fender bender. That's not necessarily a fender bender to your spine, right? It could be significant damage that you don't even know. And it doesn't take a lot of pressure to concuss the brain. And so that's not something that's going to show up necessarily when you go to the ER as well.
Right.
You'd start having fuzzy thinking. You can't remember what you were doing. And also you can start having digestive issues, which a lot of people don't realize too, because we know that our gut is our second brain.
Right.
And once you cause some damage to the brain, which we would call traumatic brain injury or concussion, and you don't have to get knocked out. So I have a lot of people think, oh, I have to be unconscious to have a TBI, traumatic brain injury, and that's not necessarily true. So when we look at the spine after an accident, we take x-rays, we do a lateral A to P, that means from the front, and then do a flexion and extension to see if the ligaments are damaged as well.
Amazing.
Because we want to avoid long-term chronic issues, because 60% of people who've had an accident will have chronic headaches after that.
So you've seen cases, people coming in after, they had a car accident recently within the last 3 months, 3 to 6 months, they come in with headaches, and when they left, they have less of a headache, or they feel better right after that adjustment.
Yeah. And one thing that's really wonderful, we have some amazing patients, our practice members, we love them. On our Facebook, one of our patients last week had mentioned how she had headaches every day. Right. And when she was done with care, she no longer has headaches. And she said she could never even imagine that was possible. And it's interesting as well is I have patients who will come in maybe 4 or 5 years after an accident, And on their initial paperwork, they'll say, I don't know if it's from this, but I had an accident 4 years ago, and I noticed ever since then. And I'm like, yes, absolutely. And that's the message I really want to get people to wrap their head around, because monsoon season is coming. And also,
Yeah.
we know nationally,
Hmm.
Phoenix has some of the worst accidents. Like, we're
Oh,
known
wow.
for it. When I moved from Chicago to here, I was like, oh, my car insurance will go down because, we have snowstorms and everything horrible, inclement weather. And then when I got here, they're like, no, actually, your insurance is going to go up because we have so many car accidents here. I'm
Wow.
like, oh my goodness, I never anticipated
Really?
that.
Hmm.
So now that monsoon season's coming, we know that that will increase. So I want people to take care of their health, even if they don't see the ER urgent care doesn't see fractures, your spine has damage. And then the concern with that is then you're more prone to re-injury if
Right.
we don't get your structure solid.
And the name of your clinic's Imagine Wellness Chiropractic, correct?
Yes.
Can you give that address real quick, and I'll also put it in
Yeah.
the description box.
It's 822 East Union Hills Drive, Suite 22. We're in a strip mall, and we're next to the Dollar Tree.
Got it. And so I read in the bio you do a lot of chiropractic care post that car accident care. Is that one of the main reasons people come initially to see you, Dr. Zamora, like for after car accident care?
Well, I'd say 50-50. I have a
Okay.
lot of families and a lot of patients who have had some chronic issues, and people have either told them, like, hey, go see our chiro. She practices a little bit different because what I do is a little different than a typical chiropractic
Okay.
visit, because corrective care, we look at the structure, and then I always take post x-rays after their care plan is done so we can compare pre and post, because it's exciting. Patients feel better, but it's exciting to literally see the change, right? Because my goal is to restore the integrity of the curve.
Wow. What are some
Um,
te- yeah,
help them us, yeah,
go ahead. Sorry, you cut out there real quick. Go ahead, Dr. Zamora.
no, and just to make sure that so that if there is another injury, their spine is strong enough to withstand it.
Amazing. So we're in 2023 now. There's so many different, new techniques, new technologies have emerged.
Yeah,
There's chiropractic medical journals that are constantly being published
yeah,
quarterly or monthly.
yeah.
What things are you doing today, if anything? Some practitioners, they still use what works for 20 years. What are new things that you might be doing today that you weren't doing, let's say, a couple decades ago when you first started?
Um, because corrective care, we do. I have patients wear head weights on their head. It's a 2 pound
Wow.
weight, which then will start correcting their writing reflex. And by writing, it's not like horse riding, it's riding like upright. Because when you're in an accident, the curve goes straight. Then what happens is the shoulders will start rounding to
Mm,
support the head, because then it's like having 30 pounds of your head pulling forward adds 30 pounds of pressure to your spine. So we have them wear a head weight while they're on a vibrational platform, which helps correct the upright reflex,
wow.
start strengthening the muscles and ligaments in order for them to come back.
Interesting.
And then we have a standing traction that will help bring nutrients into the disc, which then helps stop arthritic spurs from developing or getting to the next phase, because there's 3 phases of degeneration. So we know phase one, as soon as you get in an accident, the curve is going to go straight.
Hmm.
That's when people start having headaches, anxiety, problems sleeping. It can interfere with your breathing. You can have tightness in the chest. You can start having heart conditions, numbness and tingling in the hands and fingers. All of that from just a whiplash in the neck. And if it is uncorrected, then it will start creating health problems. So,
Wow. Yeah, and you wouldn't think even it has an effect on your emotional health after a while and on
absolutely.
different body functions. You don't realize it's tied to upstream these nerves that are being affected, right?
Yeah, absolutely. And we have people start taking some supplements to help the brain heal as well.
What are some of your favorites for that?
I just read a great article. We used to have neurotrophin from Standard Process, which I really love their supplements. But I started reading an article on boswellia, and I saw that it also helps the brain heal. So I thought that was fascinating because then you're covering a lot that, it
Yeah.
helps the body feel better overall, but then it also helps brain health. So I was like, oh, this is exciting. So now we're going to start incorporating that as well.
Amazing. So again, that's neurotrophin. We have that right here at Healthy Habit Health Foods through Standard
Awesome.
Process. They've been around since 1929, which is
Yeah.
wild. Over almost 100 years. They've been going
Yeah.
strong. And then,
Yeah.
of course, Boswellia we carry with multiple great herbal companies.
Yeah.
Um, so, what are some of the more unusual cases, maybe something that comes to mind that you were just, wow, this is amazing? This, if anything, is on your
Yeah.
radar. People always love to hear
It's
chiropractic, amazing stories, healing stories.
yeah, it's so interesting where I had a patient come in and she had muscle wasting for years. And so every 6 months, her doctor would test and see how she was progressing. Was it improving, getting worse, stabilized? And she had been doing this for 4 or 5 years. Once she started getting under chiropractic care, she said she went into her doctor and the doctor was like, I don't know what's happening, but it's actually starting to improve. And it's the first time. And she's like, well, I'm not doing anything different except for getting adjusted. So the doctor's like, well, keep it up because I can tell that there's a marked improvement in her muscle wasting. So
Wow,
that was huge for me.
amazing. Those muscles started getting their nerve supply back, right, and
Yes.
firing back to how they're supposed to,
Yeah,
and
absolutely.
regenerating.
Yeah.
Amazing. So we're talking to Dr. Roxane Zamora, folks, doctor of chiropractic medicine here at North Phoenix, and I'll be linking the phone number, website, and address below this video in the description box. So, what advice would you give someone, Dr. Zamora, who's interested in pursuing a career in chiropractic medicine? Maybe they're even in high school right now, or they went to a chiropractor for sports and they're, I don't know, in their teens and they benefited. What's some advice?
I would say definitely do it. Talk to a chiro. Anybody could always call me. I would love to talk to them because we do see miracles all the time. Um, and BJ Palmer, who founded the School of Chiropractic, he said, expect a miracle, and that's what we do. I had a baby, uh, she was 2 months old, and she had stopped having a bowel movement for 2 weeks. So she took her to the MD and they gave her some medication. It didn't work. And they're like, well, if she doesn't start having a bowel movement, we're going to schedule a surgery. So the mom was frantic, called us, scheduled an appointment. We checked the baby. I adjusted her, and because the sacrum and the low back, your lumbar, those nerves control the intestine, colon, and bowels, right? And adjusting the baby is like checking the ripeness of a tomato. I mean, there's very
Hmm.
little pressure, right?
Wow.
So you check that. I adjusted her. And as soon as I picked up the baby and went to hand her to mom, she had a blowout.
Hmm.
So those are the kind of things. I mean, not every day is amazing, right? Every day is wonderful because
Right.
we know every time a patient gets adjusted, their immune is 200% stronger. So that we know the body's healing and repairing.
Hmm.
But it's exciting to see that and to literally help change people's lives. So if you're considering it, anybody can always call me. I would love to talk to them
Yeah.
and give them some guidance.
And you work with all ages?
All, all
Yeah.
ages, from babies to I have a patient that's 89.
Wow. Perfect. Okay. So, uh, really cool. What are some tips you can provide for people just from listening to the show to start maintaining their good posture and spine health? You mentioned those 2 pound weights, right? Is that
Yeah.
something someone can buy right now and practice before they go to sleep or something? What else can
Well, I don't,
everyone's hunched over like this?
yeah,
Everybody. I've
definitely.
noticed everybody.
Yeah. And so we call that forward head posture, or now we
Yeah.
call it text neck, right?
Okay.
Because we've always called forward head posture, but text neck, because we are on our phones, we are on our computers with
Yeah.
our heads down. So first of all, what I would do is, raise your monitor on your computer so that it's eye level.
Mm.
When you use your phone, and this is even tricky for me, I'll catch myself doing it. If you can, hold your phone up when you're on your phone instead of looking down.
Yeah.
So those are things that I would start doing. There's some stretches you can do. And if people email us, we can send some of those to them as well. And they can also get on our email list. We have a blog once a month, and we send out emails with information as well. So those are
With
some things that you can start doing right away that help.
Good. Do you advocate for using foam rollers and those ones that go on the ground? They have the different ridges on them, and do you ever recommend those?
Yeah, and some of them you have to be really careful. If you're talking about foam rollers to roll out, yes, those are wonderful. But I've seen some instruments that they've advertised on TV or Facebook where people are lying down. It goes under their neck.
Yeah.
Those almost do worse,
Nothing.
more damage, because it's still not centered properly. Because um, for our patients, we give them traction to use at home, because I can monitor it, see where it's positioned
Right.
correctly. And I've seen, and whatever you guys do, don't get this one. I see it's like a traction that goes over the door, and then it pulls their head, so it takes pressure off. That's doing exact opposite of what you want.
Right.
It might temporarily feel good, but it's also training your neck to go straight.
Okay.
When I see those, I'm like, oh, please, people, whatever you do, do not get that over the door traction that's pulling your neck straight.
Okay.
It
Over the
has a
door
strap that's
traction,
doing
be
a
careful, beware compared to a
yes,
foam roller that goes on the ground that's probably like from a sports medicine website,
yes, yeah,
kinesiology type, where you roll on the floor, like the
yeah,
tight muscles, different.
yeah,
Good. Thanks for clarifying that. What are some misconceptions about chiropractic? Like, I want people to really, it's not talked about enough on podcasts. I just want to
yeah.
go deep on chiropractic. What are misconceptions that you really want people to know, or myths, or that they should know about?
Um, I One is people say, oh, once you go, you always have to go.
Okay.
And I say, you don't always have to, but when people feel well, and let's say they don't, I haven't seen them in a month, they'll be like, oh, I could feel it coming back. So it isn't that you have to always go. One, they feel better, life is changing, right? They're thinking better, their digestion is better, their sleep is better. They don't want to lose that. So it's not that they have to come back, they want to keep their health going. And I say it's like this: when you get your braces off, you still have to wear a retainer, right? Or your teeth will go back. We all know somebody
Mm,
who didn't wear their retainer and their teeth
went
went
back.
back to being crooked. And so I always encourage patients to do some kind of maintenance care so that it doesn't go back, because over time it will. That's just the physics of the spine,
Right.
right? Of the body. So that's one misconception. Once you go, you always have to. And the
Amazing.
chiropractic is only for pain, right? It's really about healing the body. I remove the interference, which we call subluxation. I remove that interference, and then the body will start healing and repairing. So it's not just about pain, it's about helping the body heal and be well.
Mm, that's a good clarification right there. That's
Yeah,
important. So I know it's going to be different for everybody if you're working on a baby versus an 88-year-old individual, the what you do for them. But on
yeah,
average, if we zoom out, what would be like a go-to routine that you would do for somebody, a basic one, a standard, let's say,
yeah,
across the board? What would an adjustment session look like, and how long would it be approximately?
yeah.
I
So
know it's
for
different, but you know what I mean.
Yeah. And I always like to clarify, our office is not a quick fix, right? It's not like you're adjusted here or there when you're in pain or when you're
Mm-hmm.
not. We come up with a care plan to literally change the structure of the
Okay.
spine. So it takes time. But what it looks like typically is we always start with x-rays for all patients, so we can see arthritis, any degenerative disc disease, what kind of motion they have. And then once they're under care, a visit is typically 20 minutes. They come in, they do some standing tractions, which brings nutrients into the disc, stops arthritis from getting to the next phase, gets the spinal fluid flowing. It helps break up muscle splinting, and the body's more fluid for adjusting. And they also do a wobble therapy that heats up the disc in the low back, and if it's bulging or degenerating, it'll pull the fluid in and start healing it.
Wow.
And then they get adjusted. I work on them, help their structure. Then they go onto a vibrational platform with the 2-pound weight on their head, and then do that for another 10 minutes. For my car accident patients, I also put them on an intersegmental rolling table because that helps heal the tears in the muscles and the ligaments and will help the fluid in the disc as well. So it could be a 20 or maybe let's say 15 to 25-minute visit,
Okay.
depending on what
On average.
therapy
Right.
patients need. Yeah.
Yeah, so it's not just you come in and get adjusted like in the movie, the cracked, and then they're out
Yeah.
of there. No, we're
Yeah.
doing using different techniques, and
Yeah.
you're spending time with them, and
Yeah.
right,
It's a
it's
process.
amazing.
Yeah.
So during the pandemic, how did that impact your practice? Did you get hit hard? Was that a big stressful time? Tell us a little bit about that in a couple minutes.
It was pretty stressful. I closed for 2 weeks, but then
Okay.
the governor sent out a letter to our board saying, will chiropractors please consider staying open? So people weren't going to the ER for musculoskeletal issues. And because, they needed it for COVID
Yeah.
patients. So then I opened back up and I stayed open during COVID. So obviously people were nervous and scared. We had some systems put into our air conditioners that would fight COVID. So we implemented a lot of safety procedures too to help everybody during that time. But yeah, it definitely like
Yeah.
slowed down. Yeah.
But you're back up. We're still going strong here
Back
at
up.
Imagine Wellness.
Yeah, we're changing people's lives here
Yeah.
in Phoenix. So
Amazing. What would you say? What would you find most rewarding about your work as being a chiropractic doctor? We're coming near the tail end of this interview.
yeah, I would say definitely seeing people's lives change.
Yeah.
It's a beautiful because other patients then love to share their story on Google reviews because they're like, I never thought this was possible. And I hear that every day. I mean, it gives them hope. And then when I hear, I never thought this was possible, that makes my day, right? I
Yeah.
know we're making an impact in our community.
Right. Yeah. You see people come in one way and leave better
Yeah.
after being with you. There it is. That's
I've
what it's
had
all about.
people who came in walkers and no longer needed it,
Wow.
right? So,
Amazing. So we've covered a lot of good nuggets of information today, from
yeah,
post-accident checks, even after you've been through the hospital and gotten the pain medications and
yeah,
all this. Afterwards, months afterwards, you might want to consider chiropractic care, at least an initial visit and workup. It can only
yeah,
help. We talked about standard processed neurotrophin as a potential supplement that
yeah,
can help with the central nervous system regeneration.
yeah,
Boswellia is an herb on Dr. Zamora's radar.
yeah.
And we even highlighted what follow-ups look like, x-rays. So would you say everybody needs to start with an x-ray?
Absolutely. Because we really do want to see how is their structure? How is the curve? Do they have scoliosis? We know scoliosis is bad because bone on nerve disease is building in the organ. So you always want to start with x-rays, what phase of degeneration, what levels are arthritic spurs, where is their ligament damage. So all those things you want to include for a thorough care plan.
What
Yeah.
have you noticed over your career with nutrition? Like one or two things that you've noticed when they take something out and add something in that helped what you guys are also treating them for? Anything to
Yeah.
mind?
I one thing a patient just brought in an article for me the other day. It was about how artificial sweeteners damaged your DNA. So people
There.
don't realize how important nutrition is, right? You
Yeah.
are what you eat. And the old saying is pay the farmer or pay the doctor. Nutrition plays a huge part in our healing and well-being.
So imagine, yeah, getting those out. It's like a foreign object almost. The body's like, I don't know, it starts attacking it, and
Yeah,
then that promotes inflammation in the nerves and the
yeah,
spine, right?
right. And actually people who use artificial sweeteners, WebMD did a study and it showed their chance of obesity actually increased by
Mm.
40%.
Because
So
it
get
doesn't,
rid of those artificial sweeteners.
yeah, because it doesn't actually satisfy. So
Right.
then you're overeating. You're trying to get that
Yeah.
fix because it's not being
Yeah.
satisfied.
Because with sugar, if you eat enough, your brain is like, stop, I
Exactly.
can't do
It's
this.
real. It's real.
Yes, right.
Dr. Zamora, been a pleasure. What's a good recap for today? A take home. We're gonna have you on again. We're just getting started here.
Yeah,
But
absolutely.
what's a good take home message for today's episode?
If you have headaches, digestive issues, if your kids have ADD, they have problems focusing, um, come and get adjusted, right? Get an x-ray of your spine. It's about health and wellness, not just pain. And that's what I
Mm,
really want people to take away.
absolutely. Perfect place to end it there. Thanks for coming on, Dr. Zamora. We'll talk to you soon.
All right, have a great day.